So the next is a panel, and so I will ask our panelists to come forward, and they are Eva DeLuna with the Center for Population Priorities, Ricardo Garay, who is with the Dell Medical School, Amy Cortes, who is with Early Childhood Director for Austin Independent School District, and Jill Potter, who is with the Population Research Center of UT Austin. The reason I asked these particular individuals is that they come from a different walk of life in the city of Austin. So I'm hoping that they'll be able to address us from a different perspective, each one of them. And I believe the first one to speak is Eva. And I don't remember the names of your PowerPoint. Well, they're all called Census.
Does this work?
Yes.
Okay. Everybody's afraid to move in case the sound goes wacky. And we apologize for that. There's always audio, visual, and sound glitches that you don't know until you're actually talking to an audience, but we do appreciate everybody's patience with that. We really all want to thank Joanne for everything she's done for this event. We all would not be here without all the coordinating and logistical work she's done. So we appreciate your being here as well to find out more about this. And the panel is going to touch on some of the things we've already heard about, maybe get a little more specific about things. Mine won't be too long. I guess since I'm kicking us off here, I'll also remind everyone on your way out, there's plenty of handouts that you might have missed on your way in. The speakers already have referred to some of them. Rebecca, for example, mentioned the census dollars, what matters to Texas. I'll be touching on that as well so you understand a little more about it. But the ones that we have here today are, let's see, if you go to the next slide. The Center for Public Policy Priorities is a nonprofit here in Austin. We work on health care, some of you may know us for that area, education, school finance. Yeah, even if you don't move, something like that happens. Education, healthcare, workforce development, all of that as it relates to what can the state do, especially what can the state do for low and middle income families. How can we help families get ahead? The state budget it should be more of a part of that than it's been recently, but the state budget is where we get funding from the state and the federal government that is either spent directly by state agencies here in Austin, for example, University of Texas at Austin, our public safety functions, DPS, the prison system, all of that. Healthcare, I mentioned, a lot of that gets paid directly to doctors, and then there's all the nutrition benefits. We heard also about what nutrition programs, especially in schools, do for Texas. So what we do is we look at all that. We look at what's happening through the state budget. What we're involved in right now is why the 2020 census could affect some of the big federal aid that goes to Texas communities. And the handouts that we have, this was the first one that we did back in, I think in June. Just touching on, again, some of the things you heard about, political representation, data for businesses and nonprofits that need to plan, and money. Those are the three things that the census determines, the decennial census. Complete Count Committee is another one that we're working on. Luis Figueroa just joined us at the center, and he was testifying the other day at the Secretary of State's budget hearing on what could the state do to do more at the state level with a Complete Count Committee, and also what can localities do, cities, counties. Some have the resources, some don't, so what can we do to help everybody in Texas understand how important it is to be counted. And then another newest handout that we have is Kids Count. Our Kids Count project explains the well-being of children in Texas, all 254 counties. And there the issues are, as we've heard, young children, especially under the age of 5, tend to be one of the most at-risk groups of not being counted, fully counted. So what can we do to make sure that our early education, nutrition, other programs are getting the funding they need from the state and federal level? Just to clarify, any Texan that doesn't get counted, it doesn't matter if you yourself receive that service. It affects what the state as a whole gets for everybody that needs those. The millions of Texans that get health care, the millions of students in our public schools. So the final chart that I'll show you, and then I'll move things on to the next panelist, is this slide here. This is the same information that Rebecca showed us, but it's putting it in chart form because I am a budget analyst and I speak in charts. So if you see behind me just how much Medicaid is bringing to Texas, we'll hear some elected officials complain about Medicaid and how it's eating the budget. It's a partnership with the federal government. Every dollar roughly that we spend on this of our own state tax money brings in more than $1.50 in federal money. That's money the federal government has already collected from us in taxes. We need to bring that back here to pay our doctors and dentists and mental health professionals. So this is something that we have already paid in federal taxes, and we need to make sure we're doing the most for our 4 million at least Texans that need CHIP, Medicaid, family planning, women's health, mental health. There's so many things that this program does, and I'll get just into the technicality of why the count matters. The way that Medicaid works, that $1 to $1.50 match that I mentioned, it's a formula that takes into account our population. So the fewer people get counted, the worse that match rate is for Texas. And what we talk about in one of these handouts is even a 1% undercount in 1 year could cost Texas $300 million that's lost in Medicaid, CHIP, foster care, and child care. So those are just 4 pieces of what you're looking at here. The impact would be even worse once you look at what happens to highway funding, SNAP, the what used to be called food stamps, a lot of the Head Start and early child care programs. So just 4 programs that George Washington University looked at said would cost us $300 million a year. That means money that we would have to come up with from state taxes instead of having the federal help that currently is in place. Some of you may have been around the legislative session long enough to see that when the legislature goes to write a budget and they're told that they have to come up with $600 million more for Medicaid, they don't just spring up and say, no problem, we'll get right on that. First they try and cut the program to see what can be done to control costs. It's called cost containment. Sounds a lot more polite than cutting health care for people with disabilities and children and elderly. So it matters that we get a complete count because the legislature doesn't just tend to voluntarily fund these programs because it's the right thing to do. So the better that match can be for all of these programs, the more likely that they'll be there for Texans who need these services. So I'll stop there and make sure we hear from all our other panelists. And again, all this information will be on the website. I'm available for questions at any time. We'll be helping you understand these things through social media as we get closer to the count, but I'll turn things over for now. Thank you.
Thank you, Eva. I also am a little terrified of the mic, so hopefully that will not happen. Joanna, I also want to echo my appreciation for your organization. I want to appreciate all you being here as well. And so I also want to be able to acknowledge the fact that I really liked Mayor Adler's comment on the geography discrimination in terms of healthcare. Austin cannot call itself a progressive liberal city having those outcomes. So let's start with that. I also like that Rebecca mentioned how technology is going to be able to address those disparities and actually focus on those most affected by those disparities. So I think that's on the right track. And I like that Ryan mentioned mixed families, because I myself was actually undocumented for 8 years, and I am still going through that process of becoming a citizenship. And so I worked at Dell Medical with that perspective, right? And so I was born in Honduras, And I really like my work at Dell Med because right now I am working with researchers on research and on redesigning programs that are providing access to folks that typically don't participate. And so one of the projects I've been working on is a household level assessment. And so, one of my favorite authors is this guy named Eduardo Galeano from Uruguay. And he says, scientists say that we're made of atoms, but a little bird told me that we're made of stories. And I really appreciate that because I think data is really important, but the recognition that we all have unique stories and unique backgrounds and work as a community and are part of us as a whole is going to help us really mobilize and really understand how this participation is going to affect all of us, right? And so with this household level assessment that I've been working on, I've been able to really hear firsthand the fear that folks have around giving their name, giving their family's medical situation or economic situation. And so being able to tag those realities to a lot of what's happening around this census is going to be really, really important. I spoke to a person 2 weeks ago that a mother of 2 children that did not enroll her children in CHIP because she is scared. Those are realities of what that are happening here. Now, try to put yourself in that mindset. What would it take for you not to enroll your 2 kids in CHIP? 2 kids that were born in Austin. That is what we are doing. And we have to recognize that these disparities are caused because policy is making these things happen that way. If we don't recognize these things, I think we're off to a bad start as well. These hard-to-count numbers, we should be able to recognize what is causing folks to be hard to count. What type of community and what type of society are we when there's folks that live here that are hard to count? And so at Dell Med, we're trying to address these things by going to people's homes, recognizing what their social determinants of health are. And, I'm biased on this, but I really think that the measurement of success for a government is the health of its community. And there are huge disparities here. And so, yes, government is failing us because there is a huge disparity in health outcomes based on geography, based on race, based on gender. And so we have to be able to look at that and be honest with that. The other thing that I want to mention is that things are not looking well in terms of health insurance for Texas. And so that's going to be an extra layer of challenges that we're going to have to face here. We're the state with the #1 number of uninsured in the country. And according to the Commonwealth Fund, it's going to drop by 5% next year when the individual mandate goes online, where that's going to be dropped off. That's going to be huge, and that also gives gravity to the importance of having this census be able to reach as many folks. Because in Texas, healthcare is going to be a big issue, and being able to count as many folks as Eva would say is going to be really, really important. But we have to know how to reach folks, and we have to be able to line up what is causing folks to not participate. When they see the news, when they see policy, that is scaring folks. I also was at a home last week of a mother that's going to give, a pregnant woman that's going to give birth to a kid, hopefully in mid-November. And her husband was deported. And she does not want to seek any help because she is traumatized and she is scared of engaging any organization and anyone that knocks on her door because of this situation. So policy has scared and marginalized and pushed away some folks in our community, and we have to be able to confront those things to be able to say, let's have a census that's going to capture everyone. And so, again, I'll stop there. But I'm really looking forward to having a conversation and hearing from you as to how it is that we can all work together to address these big, big challenges.
Good morning, everyone. I'm Amy Cortes Castillo, Director of Early Childhood for Austin ISD, and I do have a short presentation with some of the information that you've already heard this morning, but I do want to look at it from the lens and the early childhood perspective. So I just want to start off by saying that in pre-K we do a lot of counting. And that's one of the big focuses that we work on in pre-K, so we know that it's important to get it right. But in all seriousness, it's important to get it right for our kids who are coming to our pre-K programs. And I really appreciated the comments earlier from Rebecca about how our children are coming to school every day, what they're expecting, what their families are expecting from schools. I don't know a lot about, learning about funding and everything, but I do know that a lot about high quality classrooms, and I know that those don't come free. They come with costs. Okay. So we'll go on to the next, and I just included this quote because as I was doing the research for this, I found lots of information, and some of it you have, some of it's from the Annie K, the kids counts, and some of it was from philanthropists. And so, coming from a school district perspective, we get money from the state, we get money from the federal government, we get money from also foundations and community partners. And so this was a statement that was on a philanthropy website and talking about how philanthropists are really wanting to make sure that the census count is accurate so that they know what populations that they can support. So this was just an interesting quote. So the next piece is from the Annie E. Casey Foundation, and I would encourage you to go to their website, Kids Count, because this has a lot of great information on it, and I think it's included in the information that you shared today. But this quote really resonated with me. If we don't count children, we render their needs invisible and their future uncertain. And that's from the President and CEO, Patrick McCarthy. A major census undercount will result in overcrowded classrooms, shuttered Head Start programs, understaffed hospital emergency rooms, and more kids without health care, which is what you just spoke to. So I just kind of want to reiterate that lens that when children come into pre-K, it's many times their first experience in school, and we have to make sure that we support the whole child. And so all these services that we're able to either connect them with or ensure that they have or even provide are critical to their development. Okay, so next slide. So just to tell you a little bit about our program at Austin ISD, this slide just shares our mission and our vision. We want to provide a high-quality preschool education for as many eligible children as we can. We do a pretty good job in Austin ISD right now. We serve about 75% of the eligible children in our community. We want to increase that number. I think the statewide number for 4-year-olds is about 67% of eligible children. So the takeaway from this is just that we have to ensure that we have the dollars to provide that high-quality programming. And as we've heard in the presentations before, that those dollars are huge in terms of how related to the census. And I have a slide to show you kind of what I pulled out from that. So for the pre-K program, the next slide is just how we're funded. We are funded through state dollars from what is called the Foundation School Program. So that's our main funding source. And so when we enroll a student in pre-K through 12th grade, we get an average daily attendance dollar for them. And that money comes down directly from the state through their funding mechanisms. So for pre-K, a preschool, that's a half-day ADA. So Austin ISD, out of their own budget, our local budget funds pays for the additional half day. So we have a full day of pre-K 4. We have a half day for 3-year-olds. So, however, like I said earlier, we rely on other sources of income to be able to provide services. So the next slide just shows who's eligible for pre-kindergarten. And so as you can see from this slide, it shows that we have students who are ELL students whose native language is something other than English, qualify for pre-K. Students who are qualify for the free lunch program who are economically disadvantaged qualify for pre-K. Military service folks children of military service qualify for pre-K, children in foster care, and homeless children. And then Star Award, children of Star Award recipients. So as you can see, the populations that we're talking about today are those that qualify for pre-K, for the most part. We want to make sure that, I also want to say that in regards to the federal fund dollars that come down, if you qualify for the free lunch program or get SNAP, that's an automatic certification for pre-K. So these are the items that I kind of looked at and pulled out as terms of dollars. These are nationwide amounts from 2015 that directly kind of affect our kids that come in. And there's, I didn't include SNAP here, but I did want to just say that you do qualify for pre-K with SNAP. So these are kind of the National School Lunch Program. This is nationwide, not for Texas or for Austin. And then the school, and you have this sheet. You're able to pick it up outside. It has that George Washington University sheet. Special education grants, Title I grants, grants for infants and families, special children with disabilities, and then the preschool grants, our PBCD programming. So all of these are tied to census counts. All these funds. So you can see that it's critical that we have the best counts that we can have for our children and families. So the next slide, I was just looking at 2016 information from budget from Austin ISD, and this slide kind of shows what funding we're getting from that in Austin ISD. This isn't Central Texas, but so it's quite a bit of money. It's over $60 million, and when we're talking about us having to give back recapture money to the state each year, these funds are really critical as well to support. So we've got our local dollars, and then we've got grants that we get from the state, and the state dollars are federal dollars that are being pulled down. So it's really critical that we have as much information as we can, and that we're able to access these dollars to serve our programs. The other piece of pre-K is partnerships. So we do have a lot of partnerships with different organizations. Head Start, we have partnerships with child development centers through Texas Workforce Commission. And so these are not necessarily AISD entities, but they are affected by federal funding, and these dollars are also affected by census counts. So Head Start, this is again nationwide, and you have that on your document. Child Care Mandatory Matching Funds for Child Development, Child Care and Development Fund, and the Community Development Block Grants. So a lot of our families, sometimes, like for our pre-K3 programming, we may have a partnership with a child development center where those students we get the state, those school foundation dollars for the half a day, but they go to an off-site program outside of AISD, but they have a certified teacher, and so they're also getting subsidies through Texas Workforce Commission for childcare. So that gives them a robust full day with a certified teacher and AIC programming, but then they get that full day that they need for their child. So these are really important programs as well, our partnerships. And just to show you briefly, Head Start is one of our partners, and they serve over 2,000 children and families. And I just showed the dollar amount for their Head Start grants here. That's Child Inc. And then we have our child development centers that we work with, and that's this year the new amount is over $200 million. And that number is statewide though. Okay, so next slide. I just want to say it's critical we ensure to get accurate counts of our most vulnerable children. Our goal again for early childhood is high quality classrooms for all children, and our funding streams are critical, and our representation in Washington is critical to ensure that we're able to sustain our programming. So I feel like our next steps right now are to continue to educate our community in places such as this, and I think having some of these informational sessions for parents in the coming year would be beneficial, and we can work through that with our parent support specialists and our campuses. So thank you so much for having me today.
Hi, my name's Joe Potter. I'm a demographer at the UT Population Research Center, and I'm not really an expert in what I'm about to talk about, but I do know some of the people who are in
You have a
general.
mic closer without
Hello?
Look, there you go.
Okay, that was a kind of personal excuse of non-expertise. So I'm here to, what I chose to talk about in the openness was the addition of the citizenship question to the 2020 census. So, next slide. That's the question. So, the question here is why we care about this. This has already come up. People have mentioned, Ryan's mentioned in particular, the threat that this question conceivably poses to response rates in the census. I'll show you one piece of information later on that validates that concern. But I think the other reason to care about, well, there's two more reasons to care about it. One is the threat of misuse. What's happening here is the question that was in the ACS and the American Community Survey is being moved to the long form. So what does that do? That enables the Census Bureau to do block by block specification of people who aren't citizens. And that didn't exist before. I don't think the misuse is a question of Census Bureau employees leaking information. It's a question of whether or not the Bureau would accede to presidential requests for that information. And we'll go in a little bit, talk a little bit about the lawsuits that are concerned on that point. But I think as a community, there is the enumeration question for all the reasons that have been talked about, but there's also the threat to members of our community that such a database might eventually pose, and that has to be taken into account in terms of the local response. And just being here, it's occurred to me that perhaps there is a local level strategy that could be developed that would frustrate one aim and facilitate the other. But I don't have that mapped out, and it's other people's business to figure that out. I think I'm happy to collaborate. And the last thing is, we don't have a census form. So preparations for the census are frustrated by the fact that nobody knows exactly what the census form is going to look like because the addition is tied up in court and is likely to progress to the Supreme Court, all of which is going to postpone by a large amount having a final census form, which is going to mess up the preparations, which in turn is going to mess up response rates. Okay, so the first thing I want to talk about quickly is the undocumented population, and I've got a couple of slides. So this is Texas. I better look at my computer rather than. So you've got over 1.5 million estimated undocumented population in the state. It's 11. You've got 11 overall million. So two things to see in that graph. One, it was growing, so it's a large proportion of the state population. But two, that growth has leveled off. Texas is number 2 next to California in the number of estimated undocumented population. But this is the graph that I found impressive. Through time, not only has the population grown and leveled off, but the undocumented population more and more consists of people who have been in the U.S. For a long time. And I think, therefore, the damage or the potential damage that cruelty, whatever words you choose, of deportation grows as more and more you're talking about people who've been in the U.S. for a very long period of time. Back here. So that top curve is the percentage of the undocumented population that's been in the U.S. for more than 10 years. And so that's growing a lot, whereas the percentage has been here for less than 5 years and is shrinking. By the way, if you have time, look on the internet someday for Adam Ruins Everything and The Wall. Because there's a wonderful video that talks about why the wall is a terrible idea in terms of keeping people in and in fact augmenting the size of the undocumented population and leading to this kind of situation. It's the western states who mostly have the longest been here. The average length of time in the U.S. is the highest. So moving here. Okay, I'll have to stop there for a second. So write that down. Adam Ruins Everything and The Wall. It's wonderful. So I want to talk a little bit about the influence of the census collection on response rates. As I say, I'm not an expert, but I do collect data here in this community on reproductive health, and we have run several postpartum contraception surveys following women from delivery on out to 2 years. Although we would very much like to know documentation status of our respondents, we don't ask that question in our interviews. And even though that question is highly relevant to individual women's ability to access different contraceptive programs in the state of Texas, which differentiate according to that status. But we don't ask the question for two reasons. One, because it would, we think, knock our response rates down, which we care a lot about, and we're getting about 80% follow-up rates at 2 years. But two, we don't want to have that data in our computers lest anybody ever seek to get it for untoward purposes. So here's some information that was recently compiled about from the ACS. Now this doesn't say who's responding or not choosing to respond and so forth, but it is looking at individual questions. So these are the non-response rates among people who completed the ACS through time, going from 2010 to 2016. And it speaks directly to Ryan's point. So what you see here is that over the last 6 years, the non-response to the citizenship question has grown dramatically, whereas it's stayed constant for all the other more innocuous questions. So I think this demonstrates, one, that people don't like this question. The last slide is that, not surprisingly, the non-response rate to this question for the foreign-born is higher than it is for other groups. So on the threat of misuse, I think there's two things to say. One, it has happened in the Japanese internment following the Second World War, using the block level data. I think it was for Oregon, Washington, and maybe California. That was used to internment of the Japanese population. There's been some use of census data for Muslims, enumerating Muslims at relatively local levels in more recent times. So I don't think that's a totally unreal concern. And the second thing is that the lawsuits, and there are now 6 of them, that have been brought by different states as well as by different organizations. The question is, why are they trying to move this question into the census? The stated motivation is that this is to help with enforcement of the Voting Rights Act, not something that has heretofore been a huge concern of the current administration. And the lawsuits challenge this motivation, and they're seeking internal communications between Wilbur Ross and others in the Commerce Department as part of the lawsuits. So that's, and they aren't, what's been uncovered here before, a lot of it has been redacted, but it doesn't look like a pretty picture. Anyway, I'm not a total expert on this, I'm not a lawyer, I'm not a political scientist, but the idea that did occur to me today is that perhaps there is a local strategy that could prevent the combo. You could get your cake and eat it too, in the sense of get high response rates, but not help build a database that could be used for bad purposes. Thank you.
So we have built in Q&A time for our panel. And so I will entertain any questions that you all might have, and please direct them to all of the panelists or 1 or 2 specific ones. Yes.
Ava, I'll start with you, but maybe other people have answers as well. I know that in California, Minnesota, and some other states, there has been a coordinated effort by the philanthropic community to kind of pull together money for census stuff and then identify kinds of local community organizations or whatever who might be doing the work. Because as a community, the philanthropists realize it's important. Do you know of anything like that going on in Texas? Have you gotten any money for that kind of stuff at CCCC?
The question, if everybody didn't hear it, is about philanthropic support for outreach, complete count efforts at the local level. I think you mentioned California and Minnesota, a few other states that have done a lot more. The state we're looking at to compare Texas to is California, not because of their politics, but because they are a big state with a lot of rural communities, a lot of disparity about local resources that could be devoted to effort. So philanthropy is a big part of it. We have, I think, a small grant supporting some of our work. Annie E. Casey is very involved because of the impact on young children. And I think the closer we get to the effort, the more other groups will get support. We're, as I mentioned, trying to get the state to put some more money of its own, not just working with the Census Bureau, but some state general revenue to support what cities and counties are doing. As you're aware, the state is kind of yelling at a lot of local governments for anything they do that raising our property taxes, but if they don't want that, then give them support in the form of general revenue so that important things like this, especially one-time things, the Economic Stabilization Fund could be a great use of one-time grant money, because the 2020 census is something that just happens. It's not an ongoing budget cost, so there's ways to pay for this that don't have to cost a lot. As I mentioned, Louise testified the other day on what you can do. Basing it on some amount of spending per person is a good kind of proxy, but whatever the state does, and it's done it before, is the important thing. We had some great research done by a new person at the center who found out that in the past Texas has done this in previous census. So we talk at the legislature a lot of times, and we mention Oregon or Minnesota, and they'll be like, yeah, this is not that state, that's not going to happen here, but it's happened here before, so we're hoping that the state can do this again. The other thing that will make philanthropy more interested in this is, if you look back at that George Washington University sheet, or the chart that I pulled out, the big sources, a lot of that goes through the state budget, but some of it goes to the third biggest thing, example, Medicare Part B. That's money that's not going to the state and local governments. It's going to provide health care for seniors. And healthcare providers want elderly people to have access to health care. The money that goes for housing, the choice vouchers, and there's another one on there for housing assistance. That money does go locally to landlords. So it's not just government programs. It's people who own apartments and people who operate healthcare industries that have a say in this. So reaching out to businesses is the other thing we're doing. Philanthropy, business, and the state all need to be working together. Any other panelists want to talk about this one?
Ms. Joanne, can I add to that?
Sure.
I didn't want to talk about Houston, but that slide you talked about philanthropy, there's an initiative, the Funders Initiative, and the Houston Endowment is a part of that initiative. And so the Houston Endowment has put together a collaborative of 40 nonprofit organizations. This is totally outside of the city. This is totally outside of Harris County, and they are aggressively coming up with a census working group. And this is in those hard-to-count communities, those the Vietnamese community, the Muslim, the Arabic, the Pakistani, African communities, and they are doing various working group sessions. And the new partnership specialists were able to see what they're doing, and they will be putting funding together to those 40 nonprofit organizations to do philanthropy. They decided to take a proactive approach because they understood that there are a lot of political ramifications in the city of Houston and Harris County, that when they issue the RFP, a lot of those people that need to do the PR work may not get it. It may be a friend of a friend, so to speak. So the Houston Endowment has said, well, we're going to do our own thing. We're going to be grassroots, and they're doing a community CCC. So they're not affiliated with Harris County or the city of Houston. I would hope in a perfect world that Austin would be able to mimic something similar, because they do have some of the same challenges. But I know that for sure Houston has been doing that. And they're part of the Funders Initiative group. I can send the email. It's a whole packet.
This is for Joseph, and I could have missed something, but I was reading that census question, and it seems to me if you're a green card holder, you're going to be in that last category. Am I correct? Because if that's the case, they're lumping everybody into not being a citizen. That includes the DACA holders, the green card holders. It includes everything. What use is that?
I don't have the answer.
I was stunned that they didn't have a place there there for the green card holders. I really was. I was expecting it.
Did you have a question or a comment?
Mine was basically on hers, it's an additional comment. Not only does it not include the green card holders, the long-term resident, it doesn't include refugees and asylees. So there's at least 4 different communities that fall under that, not a U.S. citizen. So like you said, it's pointless. You're still not going to get an accurate count.
Yeah.
Be that as it may, what can it be used for? Whatever it can be used for, you can get out of the ACS. So the addition of having this block level information is, that's the harder question. I mean, I'm not saying, I'm not defending the question, but whatever you could use it for, you could get from the ACS.
On the proposed questions paper that's on the census webpage, it says a question about person citizenship is used to create statistics about citizens and non-citizen populations. And that's the fear that we have. This is the first time that I'm being asked when I was naturalized. So there is another criteria for me to be put under where I don't really know. I'm here legally. I've been naturalized, but now I'm being put in different categories. I am no longer a citizen like I was told when I was naturalized. That's the fear that we need to
testify. I want to swing in a different direction. Sure. My question is to Amy. You had a chunk of money coming into early childhood education through community development block grants. How did you structure your ask to get that money for education?
So that money comes through Texas Work. It doesn't come directly to the school district. Are you talking about the 200?
I'm wondering what was your ask? Not the amount of money, but through what mechanism was the request to fund this?
So TEA drops down RFPs for grants. So they had a partnership grant last year and this year, and the partnership grant is funds from that grant. And so what that grant worked on was us building partnerships with child development centers in the city. So if you have an eligible child attending a child development center, so say Open Door, Mainspring, Head Start even, then we can draw down the FSP funds as well. We can enroll that child in Austin ISD. It's a virtual campus. Okay, so that's the mechanism for that. And so we do have those partnerships currently, and so it's sort of getting a dual funding so that they can have that other half of the day through the Workforce Commission funds.
Okay, this is for Ricardo. You are stated that you're working on a project, a household evaluation project with the Dell Medical School.
Right.
Is part of that project, beyond the policies and all of the other stuff, recommendations or brainstorming about how we as a community can do better in those areas, those fear areas?
Yeah, I go into detail as to the many goals that we have with that project. But I think the main goal is to be able to identify the social determinants of health and be able to recommend and build projects that are based on those needs, that are going to be very local. And so we feel that by going into people's homes and actually asking them questions where they live, about how they live, we can be able to better design and do research and bring funds to those needs. And so it is based off of that we feel it's been a very important dynamic to have people open their homes and for us to acknowledge what it is that what their lens is around a lot of these questions and the fear and wherever that's rooted. And so, yeah, to answer your question, the answer is the goal is to be able to identify those as social determinants of health, and immigration status is a big one.
Can the information, though, that you gain from your study be incorporated into the Census project? I don't know, whatever your results are, whatever you come up with that says, I can help these people that are scared in this approach, will that approach somehow be able to feed into the Census project to help them get those people counted?
I'm so glad you bring that up because it's a very delicate line to walk, right? Because we are capturing information that is very delicate and we want to make sure people are willing to share that with us. But being able to put that out there as well could be, in this current environment, put someone in a precarious position. And so we have to be very sensitive of that. At the same time, we do want to share with other partners in the community that these are needs, that these are realities that a lot of times get maybe muddled by big data, right? I mean, we see graphs, and then those show trends, and don't get me wrong, data is really good. But being able to also tell stories about that data is also very, very important. And it should be a complementary piece of that data too, to say those realities are happening here in Austin, so we can be a lot more critical about policy. I mean, that question, let's not fool ourselves. That's a scare tactic. And that's a scare tactic based on racism, and racism that's based on nationalism. So let's be honest about those things and be able to say these are challenges and let's address those things, because that's what's really affecting this. And it has real consequences for generations to come. But if we don't acknowledge those things, then I think if we dance around those issues, then we're not able to address them, right? And so it is a fine walk, and we have to be very sensitive, and we're really trying to have folks believe and trust that we are collecting this data to provide them solutions and to provide advocacy for their problems.
I have a general question for, I guess, everyone. Is this census, is there a bigger sense of urgency because of the current environment than there was for the 2010 census? Well, I know that, but people working the census, I mean, is it different now?
Well, I guess I'm stuck with the answer to this question. That's one of the reasons why we're having what we're having here, right?
There is urgency.
Right.
And I'm hoping at the end of the day, like millennials say, are we woke? I'm hoping we're woke today. I'm hoping we're woke, that we have people that are on the ground that look like people who are underserved and undercounted, that we are doing or just doing that. I hope that we are woke to understand changes. I hope that we're woke to understand the reason why this is important, so that my kids can have a great education. They can get their 3 meals a day. I hope we're woke on that aspect. And that is why I'm here today. I'm here as a Goodwill ambassador, and I'm listening to concerns because they are valid concerns, and I understand that. But at the end of the day, as a federal employee, I am here to educate, engage, and make sure you have the message so that your organizations can be a drum major for your community. That is what I'm here for. And I want you all to know that I'm here with an olive branch to do so. And we have people finally on the ground that can be a resource to you and be a one-stop to you. And also, we're recruiting. And we're going to be recruiting in those hard-to-count populations, and we want people to apply. Do you know when we post jobs, I'm almost harassing Ryan because we don't get people to apply. So if you want to be a part of this urgency, let's be part of the mission. Let's get involved. Be a recruiting assistant. So when you do knock on the door, they say, oh, she looks like me. She lives in my neighborhood. That's my neighbor. And that's what we want to do. And that's what I hope we can do at the end of this presentation.
I don't think it's fair to ask the census if they're doing a better job this time than they did last time. Of course they are. I would tell you that from the perspective of the city and the county, Mayor Adler, Judge Eckhart, they are taking this much more seriously. And they understand that if, in fact, there were a reduced effort on the part of the Census Bureau, not that is happening, it's going to be up to us local leaders and especially our local governments to step up, and that's what they're doing.
I'll also add really quickly that that the Census Bureau, I mean, is doing what it can, but every time we do this, it changes. I mean, there's a change in how it's done online. I mean, that will make things some better for some households, worse for some. The somebody knocking on your door, I mean, just assuming that everybody has internet access. I mean, this is Austin, but there are a lot of people who don't have a computer at home. But the other thing I want to mention, I'm a history and literature major, so in addition to showing charts over 20 or 30 years, because sometimes you have to go back that far to when things were better funded in Texas, the idea that it's easy to do with the decennial census. I was in Washington, D.C. for the 1991. And at the time, there was a lot of refugees from Nicaragua and Guatemala and El Salvador who had been pretty traumatized by the time they got to Washington, D.C. And then there was all these posters being put up to scare people away from answering the census. So I think today we hear a lot more about terrible things that are happening. The public charge issue hasn't been mentioned yet, but there's so much happening now. That's not just the Census Bureau, it's all the other federal agencies that do make it more challenging. But I mean, we have to try what we can do, whether it's nonprofit or business or elected officials. But every time we do this, it's tough to do. It's never going to be perfect, but the goal is to make it at least as accurate as it was the last time. We can't afford a setback. That $300 million that we could lose in 1 year, we'll be stuck with that for 10 years until the 2030 census. That's $3 billion that we lose for healthcare. And that's something that either comes out of our scarce tax dollars or gets shifted to the county and city. And we have to understand we are stuck with the racist and nationalist question, maybe, unless the lawsuits are successful, but we have to figure out what else we can do. So another question up there.
This is more of a comment. I know that we keep talking about educating residents and community members, and I love that the city, the county, AISD, and Dell are all here included, but we can also take this opportunity to empower our residents and informing them that they are part of the difference and change, hearing those issues and having those issues drive their, the policies and whatnot. So I think that should also be included in the conversation of how are we empowering our community members as we're educating them about the census. How are we getting them civically engaged?
I just had another quick question regarding the date of citizenship on the question. Has that always been a question somewhere else on the form?
Is the question, has everybody been asked the U.S. citizenship question in the decennial census? It's collected on other things, but not everybody gets the American Community
No,
Survey.
the year of nationalization.
I think that's an American Community Survey question. I think this question that's being proposed is, are you a U.S. citizen? Yes, no. You don't get to say what your status is. So I'm a green card holder. I don't think I get to explain that. If you're naturalized, so the decennial census, the one we're talking about, is as I understand it, it's a yes/no question.
What was up there?
The ACS, yeah, the ACS asks about all kinds of other details and status.
The proposed citizenship question, that was the slide that was up there, was yes, born in the United States, yes, born Puerto Rico, Guam, Virgin Islands, Northern Marianas, yes, born U.S. citizen, their parents, yes, naturalization, and then year of naturalization. Has that always been on the form somewhere?
Or is that been asked in other surveys? But I'll let him answer. That's a different question.
I can't speak about the subgroups, but the general question has not been on the long form. What, 619?
Is the proposed question for this coming one the question you had up on the screen, or is it just the yes or no question?
The proposed question is the one that's up on the screen.
And the critical difference pointed out by you in the back is when was naturalization. Until you said it, I didn't get it. That's never been asked.
Never been
asked. Yes, it's binary.
That was my
Naturalized or not. Think about how different it is, and thank you for that, is to when were you naturalized. That's a big, giant step, to me, towards invasiveness. And again, that experience. So but the fact is, it hadn't been asked of everybody since 1950, and I'll repeat my earlier comment, the United States in 1950 looked a lot different than it does today.
Sorry, please.
Stop that.
Yes, this seems to be an obvious question, but I haven't heard anything about the problem with the internet and interference with the internet. I mean, we don't even have electronic voting in Texas for the same reason that I'm concerned about this.
Security.
Thanks.
You want to address that one? It's a hard question.
I have a simple talking point for that. It has been vetted. That computer mechanism has been vetted, and we are upholding the most up-to-date technology for security. Just to add on to that, we did congressional visits with one of the partnership specialists in San Antonio. We went to visit Congressman Hurd's office, and if you are familiar with Congressman Hurd, former CIA, all of that, he is on the technology committee that vets all of the systems that are utilized for the federal government. And he told us specifically if there are any concerns or any community has any concerns that this is a safe census for 2020, he's willing to come talk about it, to advocate for that. So if there are any additional questions that you may have on the safety and security of that, Congressman Hurd is willing to speak on that, to advocate on how safe it is to complete that form online.
I
guess one aspect of safety in computers that I would point out is you can have your site be as safe as possible, but in this day and age, fake sites are often where people get caught, right? So I guess, are you aware of any efforts to watch out for fake sites and make sure that they get shut down as soon as possible and prosecuted?
I'm sure our technology department is handling that. I don't have any talking points on that. If that is a question you want me to do a deeper dive on, please let me know. We can chat offline on that. Okay, thank you.
Okay, will you help me thank our panelists?